Today?
Yes, hi.
Go.
Oh, you want me to talk
Yeah,
about
yeah. Hi, Vinay.
Hi.
Vinay, I'm a doctor. I work at Cedars, yes.
Hi, my name is Vinay Agarwal. I'm a doctor. I'm a primary care doctor. I work at Cedars. My background's internal medicine. I'm primarily a hospitalist who's now starting an outpatient practice that's more of a concierge, sort of a cash pay, direct pay practice. That's why I'm here tonight with Nat and Gordon.
Perfect.
Hi, my name is Shamim. I'm also internal medicine-based physician, primarily hospitalist, but now trying to get into outpatient practice, partners with Vinay, setting up a private practice in Los Angeles.
Wonderful. Why would the MICA platform be applicable to inpatient setting?
I think the MICA platform would be an invaluable addition to the inpatient side. First off, patients would be able to share their medical information with their colleagues, with their friends, with their family. That would negate the need for the physician to spend a lot of time updating the patient's family's medical conditions all around the country. It would give nurses the ability to document everything that's going on with the patient in a Facebook type of medical record that the physician could be able to access from home on his iPhone, that the patient would be able to see. And it doesn't necessarily have to interface with the hospital medical record. It could be an add-on kind of supplement to the patient experience.
Yeah, I would agree with everything Shamim says. I think also the benefit of having this inpatient process is even if you're an outpatient doctor, the handoff or the experience of the patient, which is a unique experience when they're in the hospital compared to when they're in the outpatient side, could be handed off on the outpatient side, and the doctor on the outpatient side could act on this incredible life-changing experience that the patient has in the hospital to their outpatient regimen and medical treatment, and have a proper sort of coordinated care system for both the inpatient and the outpatient side. So that really is the handoffs, that's the key.
It would also simplify the handoff from hospitalist shift work that the model has evolved into. In other words, a hospitalist coming in at 7 p.m. would know exactly what happened to the patient if it was a more of a Facebook-style medical record, as opposed to the typical medical record that we currently have in place, which is either paper or some antiquated medical record system.
So for an internal medicine doctor like yourself,
yeah,
this is a big plus for your patients.
Absolutely. I mean, I think the easier you can make documentation, the easier that I can look up information about what happened to my patient would be an invaluable addition. Because a lot of times you don't really know what happened to the patient because it's not properly documented or it's incorrectly documented.
I think another big piece is from the patient's perspective. We talked about their families. If they were able to, in the hospital, engage with their clinical team through a laptop computer, as you know,
right.
Most hospitals are set up electronically, they have Wi-Fi now. The patient can be on a laptop, if they're able to, and actually communicate with their clinical team and say, hey, why is this happening to me? Why is this nurse doing this to me? Why is this physical therapist trying to make me do this? And the patient, after hours or during the time when the doctor can't be in the office, will actually be communicating with the doctor, and the doctor will know how to respond to the patient when he walks in the room, or she walks in the room. They won't be surprised by the patient's questions. They won't be, they would know ahead of time. It's a proactive system. It's a system that allows the patient and the clinician to really partner in their care. In the hospital setting,
particularly the family member that's with the patient. Yeah.
Also the family member.
I think yet another addition would be the ability for the patient to share their medical profile with the subspecialist, let's say in Europe or in New York, and be able to get a second opinion. And this way, the subspecialist would know all their medical information because it's like in a Facebook format. They would know, what kind of labs they had. They would know what kind of studies they've had, and they'd be able to communicate with the physician in the hospital and say, hey, it sounds like maybe we should do this, or have you thought of that, or maybe try this. I mean, the possibilities of this type of medical record would be endless.
Yeah, and I think eventually hospitals will get on board with this idea. I think eventually hospitals will get on board with this idea because their clients, i.e. the patients and their families, are going to demand it. And you would even probably start seeing, I don't know if it's telehealth or hospital health or whatever type hospitals form, where you have this service, where you have
Hello Health enabled hospitals.
Exactly.
Yeah.
Yeah.
Exactly.
Yeah.
Wow.
You'll
Or
have-
Hello Health wired hospitals.
Right.
You'll have
Something.
the
Yeah.
vital signs going through this system. You'll have
Right.
the labs going through this system. The imaging, everything going through this system.